So that's 2/3 of the recovery is tax cuts for you and help for people who've lost their jobs or losing their health care, or for states so that they don't have to lay off teachers and cops and firefighters and other essential services. That's what this recovery package was all about. Now, the last third of the recovery package was making vital investments that are putting people back to work, but are also going to create a stronger economy in the future. We're already seeing the results of these investments, including upgrades to community health centers across southwestern Virginia and right here in Bristol, allowing them to serve more patients in need of more care. And all across Virginia and this country, we're rebuilding our crumbling roads, our highways, our bridges, as part of the largest new investment of infrastructure in America since Eisenhower built the interstate highway system back in the 1950s. Now, a lot of this is going to take time to complete, and it's not solving all of our problems all at once. But we are stabilizing this economy and moving it forward in part because of the actions that we're taking. We're not going to rest, though. I'm not going to rest until everybody who wants to find a job can find a job. But there's little debate that the steps that we've taken in the first 6 months help to stop this economic freefall. This has all cost some money to do. Although I've got to admit, when I hear some of the critics talking about out-of-control spending, I can't help but remember those are the same critics who contributed to the $1.3 trillion deficit that I inherited when I walked in. They basically handed me a bill for $1.3 trillion and said, here, fix it. And now they're on TV saying, why haven't you fixed it yet? In the middle of the greatest recession since the Great Depression. So we've got to keep this in perspective. But what is true is because of the significant debt and deficits that we have, a lot of people are saying we can't go any further in tackling some of our long-term problems. And we especially can't do health care. And I understand why people feel like they've got to cut back, and why shouldn't government have to cut back as well, is now really a time for government to wade in and try to do something about health care. I think it is. And let me tell you why. Part of the reason that we're doing this town hall here at Kroger is because Kroger provides health insurance to its associates, as many as it can. And that is significantly different than a lot of companies out there who aren't providing health insurance for their employees. In some cases, it's not because they don't want to, it's because they can't afford to. And the fact of the matter is that health care is going up so fast that I hear from small businesses and large businesses alike that say it's unsustainable. Our costs are going up 20% a year or 30% a year just on health care costs. So what happens? Over time, either employers start pushing more costs onto their employees in the form of higher premiums and higher deductibles and other out-of-pocket costs, or they just stop providing health insurance altogether. That's why even if you've got health insurance, you've got a stake in making sure that we can turn this system around. Premiums are going up 1/3 faster than wages. Your out-of-pocket costs are going up 62%. We spend $6,000 more per person on health care in this country than any other nation on earth. We're not getting a good deal for the amount of money that we're spending. And I said this the other day, if somebody told you that you were spending $6,000 more on the car that you bought than your neighbor, you'd be pretty annoyed. And you'd say, I want to get a better deal. And yet we don't do the same thing when it comes to health care. We don't get the best deal that we can. And that's why we've got to reform it. Let me just talk a little bit about what exactly we're trying to do and what it will mean for you. First of all, no one is talking about a government takeover of the health care plan. As I was driving up, I saw some signs. You know, some folks were all riled up. You know, they're listening to certain radio programs or watching certain cable shows. And so somehow I guess they think we're just going to take over health care. I've tried to say this over and over again. If you're happy with your health care, you're happy with your doctor, we're not going to force you to change it. Kroger's is providing health care to its employees, then we're not going to change that system. What we are going to try to do is work with Dave and others to see if we can control the costs so that they can keep on providing health care at an affordable cost to all of you. But we're not going to be changing your system if you're happy with what you've got. Under the reform that I've proposed, if you like your doctor, you'll keep your doctor. If you like your health care plan, you will keep your plan. Now, if you're one of 46 million Americans who don't have health care coverage, you'll finally be able to get quality, affordable coverage. Now, what a lot of chatter out there hasn't focused on is the fact that for people who have health insurance, oftentimes they're still not getting a very good deal. And the reforms that we're proposing will help make dealing with insurance companies a little bit easier for the American people. Let me give you some examples. Right now we have a system that works well for the insurance industry, but it doesn't always work for its customers. What we need and what we will have when we pass these reforms are health insurance consumer protections to make sure that those who have insurance are treated fairly and insurance companies are held accountable. Let me be specific. We will stop insurance companies from denying you coverage because of your medical history, because you've got a pre-existing condition. I'll never forget watching my mother on her hospital bed dealing with cancer, trying to argue with health insurance companies, even though she'd been paying her premiums, saying that her cancer was a pre-existing condition, even though it hadn't been diagnosed when she first got her insurance. And I said then, and I continue to believe, that that's not right. And I'll bet many of you have heard of somebody, or maybe have experienced yourself, that same kind of situation. With reform, insurance companies will have to abide by a rule that says they can't drop you just because of a pre-existing condition. And that also means if you lose your job, or if you change jobs, or if you decide to start your own business, that you're not prevented from getting health insurance. That will give you some security, especially in a tough economic situation. With reform, insurance companies will have to abide by a yearly cap on how much you can be charged for out-of-pocket expenses. No one in America should go broke because they're sick. We'll require insurance companies to cover routine checkups and preventive care like mammograms and colonoscopies or eye and foot exams for diabetics. That way, we can prevent illnesses instead of just paying for them when they're going to the emergency room because they get really sick. No longer will insurance companies be allowed to drop or water down coverage for somebody who becomes seriously ill. It's not right, it's not fair. And we're going to stop insurance companies from placing arbitrary caps on coverage that you can receive in a given year or in a lifetime. So whether or not you have health insurance right now, the reforms we seek will bring stability and security that you don't have today. And those reforms become more urgent each year. Now, back in Washington, there's been a lot of talk recently about the politics of health care. They've been saying, well, Obama's got to get this done for his political survival. Listen, first of all, I've already got health care. Second of all, I'm only 6 months into a 4-year term. I'm not thinking about the politics of this thing right now. I'm thinking about the fact that if we do nothing, then I can guarantee your premiums will double. More and more people will lose coverage. Business profits will be strained, which means that Dave will be able to hire fewer people. And our federal budget is going to blow up because most of the growth in our federal budget, it's not on pork projects. It's not on some government spending plan. Most of the growth in the federal budget, the biggest reason for our long-term deficit, is Medicare and Medicaid spending. By far. It's not even close. And if we can't control the rate of inflation on health care, then it doesn't matter. I could eliminate every single non-defense program out there. You'd still have a huge deficit. The only way we get control of this is if we control our health care costs. And that's why this is so important. But I'm confident that we're going to get it done. And we're going to get it done because of you. Because I think the American people, even though sometimes they're a little suspicious of what goes on in Washington, recognize that when we meet a challenge, we don't shy away from it. This is a major challenge, getting this economy back on track, fixing our schools, making sure we've got an energy plan that makes us energy independent for the future, and that we fix our health care system so that our families are secure and that our economy is stronger. So I hope I can count on your help. I appreciate all of you hosting us today. And with that, what I want to do is just start taking some questions. Thank you very much, everybody. Thank you. All right. So what I'm going to do is I'm just going to call on people as they raise their hand.